Our second lecture here is now by Dr. Isha Dave. It will be wonderful to have interaction with her. She is a senior optometrist and runs her practice as Primary Eye Care Center in Mumbai. She is also academician teaching as a senior faculty in Lotus College of Optometry, Mumbai. And above all, she is the co-founder and clinical director of ASIRA and EMR, which is a practice management software for eye care professionals. I am the user end of ASIRA, and I'm proud to say that we have really had good experience with it. There's something more to tell you about it, and today I invite Isha to start with the second part of our lecture, which is history taking, run through it and integrate it with this software. So over to you, Isha, for our history taking presentation and more about ASIRA.
So I've already been introduced. So first of all, I just wanted to quickly talk about why documentation matters. So why is it important? And it's something that is that's heavily underrated in our practice, but with the new laws and guidelines and regulations coming in because of the NCAHP Act, clinical documentation will become even more important as we will be held accountable for our patient management in the same ophthalmologist. So therefore, it's really, really important for us to maintain clinical records. So first of all, it protects the so above all, the patient are number one as clinicians. Accurate diagnosis and treatment. So we're going to talk about how when you history carefully, it helps continue for that particular patient. Now it keeps everybody on the same page. So a lot of us have multiple practitioners, and sometimes the patient may not get to see the same practitioner again. So of course, it's much easier if the new practitioner is easily see discussed before and um consistent way reducing medico-legal risk. Now, this is something that in India, as optometrists, we have never really thought about before because we have not been regulated in the same way as other healthcare professions. But we're very close, as you all know, to getting to the same stage of regulation. And so medico-legal risk and medico-legal insurance and these things are going to become a norm as we move forward. So this is something that we have to consider when we are in our daily practice. Let's talk about what history taking really captures. So why do we do history taking? So I know you guys have already had a lecture on how to take a history. So I'm not going to go into those details. I'm going to go into more the whys and the hows, okay? So what we're capturing is the patient's story, number one. So why has the patient come? The symptom timeline, something that people often forget. The functional impact, both in terms of quality of life and the patient's vision. What risk factors there are for any particular conditions, ocular conditions that we would find out from taking a very good history. And of course, previous intervention. So what kind of ocular history has been done? Do they have they had any surgeries, etc.? And what have been the outcomes? So this is what we're really trying to capture from the patient, the full story of the patient. Now, when it comes to documentation, this is where good notes versus good memory comes into play. Now, we all know that memory can be choppy. No matter how young we are, how smart we are, we cannot always rely on our memory to remember. I know for a fact that if I've seen a patient a year ago, I'm not going to remember what my management was. I'm not going to remember what the patient complaint was. However, and if you don't remember these things, the patient does not get a good impression of you. You are expected as a clinician to remember these things, to remember your patient. So the best way is to maintain good notes. So if you're relying on memory, you'll miss details, you'll miss discussions. On the same day, you would have had so many discussions with so many patients. How are you supposed to remember? Clear notes help you think better. So if you've just seen a previous patient and now a new patient comes in, you can literally wipe your screen clean of the old patient because that is done, and open your screen, which will give you your patient that's just come in, and you'll be able to see the previous notes of that patient. And the consistent notes help the other clinicians follow your plan. So if you've very nicely documented what you're supposed to do, it will help other clinicians follow the plan. And strong documentation builds clinical confidence. So you'll be able to um, build on yourself and build on how confidently you can prescribe and you can manage your patient. Now, of course, there are gaps, and these are gaps meaning we often forget to write things. And I'm not just talking about new practitioners, young practitioners, even ophthalmologists that have been practicing for years, people like myself, like Anita, like Monica, people who've been practicing for many, many years. We can still miss things, and then later on come back and think, oh, I should have asked that. So um, these are where documentation gaps. So, for example, if the symptoms are vague, so when you look at a clinical record and there are vague symptoms, there's no complete picture, then timelines are missing. When did it start? For how long did it last? There's no baseline measurement. So, what was it before the symptoms? So, how do we monitor? Has it got worse? Has it got better? Then, of course, an incomplete systemic history. So the patient had diabetes, but it was not mentioned, missing medication. So often people forget to ask about medication. And of course, any red flags, that there's no documentation if there are any red flags. So why do these gaps matter? Because number one, you can get a delayed diagnosis. Small things like, is it sudden onset or has it been there for a long time? So when did it start? Did it start yesterday or did it start 3 months back? So this can delay diagnosis. Then, of course, you can make incorrect management decisions. Then there'll be repeat testing because it wasn't documented that this has already been done before. So there's poor continuity of care, and then a higher chance that your patient will be unhappy, dissatisfied. So on the worst and the best case scenario, you will lose that patient. They will prefer to go to someone else. Worst case scenario, they can make an official complaint about you. So these things, this is why it's very, very important to ensure that we have filled all these gaps and maintained a very clear history. So what does good look like? So I keep saying maintain good documentation, good clinical documentation. So what does it actually look like? So first of all, it has to be clear. Clear means legible, it's readable. Handwriting is readable, or whatever you're looking at is readable. Then it has to be structured. So it's not that I have to go searching. If I'm looking at something, can't go searching what is written, where do I find this? It's in a very structured place and it's complete. So all the information is given. Then, of course, it's objective. There's a consistent use of terminology. So, for example, some people might do a cross, some people might do a plus sign, some people might use short forms, some people might write essays. So that is not good because a lot of shorthands and short forms that I use, somebody else might not understand. So we want terminology to be consistent so everybody understands. Then, of course, it reflects your clinical reasoning. So all of this complete history, in the end, once you finish your examination, it will reflect that. It'll tell you the full story. So this is what the history was. This is what my clinical findings were, and this is the management. So the full picture is very, very easy to see for a fellow clinician Or if you're referring, so when you're sending a referral, if you've done a very, very clear, good history, then it makes it much easier for whoever you're referring to understand why you have referred. So now I'm not going to talk about this in great detail, but as you already know, these are the things that we want to capture: the chief complaints, the onset, duration, progression, symptoms, triggers, visual needs, daily tasks, ocular history, systemic history, family history. All of these things are things that we want to capture. So then what do? We want to turn our answers into useful notes, okay? So whatever the patient is telling us, so when we are capturing all these details, we're obviously asking the questions. So however the patient is answering us, we have to turn patient language into clinical language, which can often be challenging, okay? Especially for people who are new to the profession, who are new to sort of collecting clinical information. So how do we, otherwise what happens is, and I see this with a lot of my students, they end up just writing essays. And as you all know, you don't have so much time to write essays, and you don't have so much space either to write essays. And when you start writing long histories, that's when things get very confusing and it gets very difficult for another practitioner to read. So we want to add what is relevant. We don't want to add irrelevant information, but we want to make sure that we don't miss something that is relevant. So again, that can be a little challenging to choose when your patient is giving you 10 points of information, which points are relevant and which points are not relevant. Then, of course, you want to group all your details correctly instead of having one thing here, one thing there, one thing there. So, for example, you want to collect your complaints in the same section. You want to collect your ocular history, your general health and medication. All of these things should be in the same. So it shouldn't be that, oh, first you've written patient has diabetes, then you've written patient is complaining of reduced vision, then you've written that patient is a software engineer by profession. Then under that, you've written the patient is on this medication. No, it shouldn't be like that. It should be very systematic and all the related sections should be together. And then, of course, we want to avoid copying old notes without verifying. Okay. So, of course, we will have the old notes to refer to, but we also have to check, are you still using these drops? Are you still taking these medications? Are you still having these symptoms? So, are you still wearing these spectacles? Are you still wearing contact lenses? So, you may have all your old notes, but you must verify it as well. Now, again, documentation will help for the entire team, not just for the practitioner, okay? So a lot of the times, if a patient calls or patient comes in, has questions, is unsure, and maybe the senior practitioner is not available, they're busy with the patient. So the junior practitioners, maybe sometimes the technicians or even the receptionist should be in a position where they can answer basic questions. So if there's an intern or a junior practitioner, then at least they'll be able to look at the notes and they should be able to understand the notes and answer basic questions. Then, of course, you can have a very smooth handover within the team because everything is documented very nicely. So you're not asking the same question to the patient again and again. You're not repeating the same procedures again and again because you've clearly documented what has already been done and what has not been done. And of course, it makes audits and quality checks much easier because you can see, okay, why was this done and why wasn't this done? So it's much easier. So now when does it go wrong? So I'm just going to give you a few examples of when these are not real, but they're not necessarily real, but they're very realistic examples of when it can go wrong. So for example, somebody forgot to document medications. The patient was on topical steroids, but wasn't asked about systemic medication. So maybe it was a young patient, wasn't asked about topical or systemic medication. So it was a young patient and they had an IOP spike. And it looked like it was just today, but it wasn't. It may have been there for a long time, but because Nobody asked them about topical steroids. It wasn't checked. So that delayed the correct management. Another case is when you're not documenting the symptom timeline. So, for example, a painful red eye, it's just written in the notes, painful red eye. But you have not asked about onset. You have not asked about severity. And so you don't know when it started. So a previous visit, because they didn't ask, it could have missed an early microbial keratitis, which was not detected until it became worse. And as we all know, the key is early intervention for any ocular disease. You catch it early, the chance of the prognosis being better is much higher. Then, of course, taking a vague history. So if you look at a previous notes, it says flashes, no pain, but there's no description of frequency. There's no description of duration. There's no description of onset. So all of these things, again, was not mentioned. So then again, a retinal tear is picked up at a later visit. Now, we all know with any retinal tears or detachments, there is a certain urgency in when it has to be detected and immediately referred. And then, of course, case four, which is probably the most common scenario, is that because it was scribbled very quickly, it looks like sudden loss of vision, but it's meant to say slow drop in vision. But it's scribbled, so it was misread. So the next clinician treated it as an acute case, and the patient has been sent for testing that wasn't required. And this is a very common scenario in a lot of situations. So now, why do we want to make good notes? So this is the link to patient trust. Ultimately, the patient will trust you, will come back to you and keep coming to you when they trust you. Nobody's going to every single relationship is in life is based on trust, including a practitioner patient relationship. So if the patient doesn't trust you, they're not going to come back to you. And how do you maintain that trust? By knowing the patient through and through. Now, when you have 500 patients, there's a very low chance that you will even remember their name. However, if you have very good, well documented notes, then you will have something to refer to before the patient comes in. You can look at their notes, and then the patient will be very happy because they will be under the impression that you know that patient's case very, very well. So the patient feels more heard. They feel more like, okay, this practitioner understands me. This practitioner knows me. This practitioner knows my case. I don't have to keep repeating myself. So they value practitioners who document carefully. And of course, good notes allow you to give clearer explanations. For example, you can tell them, last time you had come, you had complained of this, and I asked you to do these things. Now you have not completed these things, which is why you're coming back with the same complaint. So it's a very, very clear journey and a very clear management from A to Z. Okay. Similarly, so for that reason, it improves patient satisfaction and follow through. So even as moving ahead, you can say now you need to follow these instructions, and hopefully next time the patient will not come back with the same complaint. So when they come back for their follow-up, you will have seen that last time they had this complaint. So you can ask them, so are you still having this complaint, or has that been resolved? So that way it helps a lot in terms of building patient trust, because they don't have to explain the whole story on every single visit. So now we already talked. So the purpose of these few slides was just to give you an idea of where we are having the gaps when we are trying to write everything manually. You end up with too many gaps, and more importantly, too many inconsistencies. So inconsistency in terms of structure, inconsistency in terms of how you document, in terms of terminologies, inconsistencies in terms of detail. So what the digital systems help you do is they help support structure and completeness. And then you have templates. So your mind, if you're trying to make notes, your mind is a little bit split, because on the one hand, you're listening to the patient and you're listening to what they have to say. And at the same time, you have to think, now I have to translate this into clinical notes. So your focus is split. You're not 100% focusing on the patient, nor are you 100% focusing on your clinical notes. And that is when these mistakes happen. So what the digital documentation does, it gives you templates. So all you have to do is select the right thing, okay? And then, of course, this clean documentation improves the workflow across the clinic. And then moving on from this, what I want to do is I want to give you a short demo of how ASIRA can help you in your history taking. And what we're going to do is we're going to do a little role play for you where I'm going to be the practitioner and Anitha, is it going to be you? Anitha is going to be the patient, and we are going to do that. Before that, I'm just going to share a very quick video about ASIRA, a 2-minute video, just to give you an overview of what is ASIRA for those of you who have not heard of us. And then we will move on to the role play. So in ASIRA, we will help you with automating scheduling, reducing human error. This is the most important thing that we would like to focus on, is reducing human error, and of course, helping you unify your practice functions. So I'll just play the video.
Welcome to ASIRA, the ultimate cloud-based solution designed by eye care professionals for eye care professionals. ASIRA is an intuitive, easy-to-navigate hub that puts all your essential tools right at your fingertips. Here, you can manage your clinic's appointments, access patient records, generate bills, and much more with just a few clicks. ASIRA simplifies record keeping with its comprehensive EMR system. You can easily search for a patient, review their medical history, and update their records in real time. Scheduling appointments has never been easier, helping you stay organized and on top of your schedule. Most importantly, you can select from ASIRA's extensive list of appointment types, each with their own customized template. As you conduct thorough eye examinations, ASIRA works quietly in the background, seamlessly integrating your findings into the patient's records. From visual acuity tests to eye care-specific drawing tools, integrated grading scales to detailed retinal imaging, ASIRA ensures that every piece of critical information is accurately captured and stored, allowing you to focus on providing the best possible care. With ASIRA, keeping your patients informed is effortless. Automatically send appointment reminders and follow-up notifications via WhatsApp, ensuring that your patients never miss a visit. And when it comes to sharing reports, ASIRA lets you send them directly from the software to your patient's WhatsApp, providing them with quick and convenient access to their results, all while maintaining the highest standards of privacy and security. What sets ASIRA apart is its seamless flow and user-friendly interface. Whether you're a seasoned professional or new to digital practice management, ASIRA makes the transition smooth and stress-free. And if you ever need help, our dedicated customer support team is just a phone call away. ASIRA is more than just a software. It's a partner in your practice, helping you focus on what you do best, caring for your patients. Experience the future of eye care management with ASIRA.
Okay, so thank you guys all for that 2 minutes, and I hope you found that video informative. So what we're going to do now is I'm just going to log into ASIRA, and we shall begin. What we're going to do is we are going to start an examination, okay? So there's a couple of ways so we're going to assume that Anitha is a new patient, okay? So Anitha, you're coming to see me for the first time. And just so everybody knows, we have not done any rehearsals or anything like that. We are just sort of doing this on the fly. So I don't know what complaints Anitha is going to come with, but I'm just going to treat her as an absolute real patient when I document the clinical history. Okay. So what we're going to do is we're going to start by booking an appointment. Okay. So what we will do is there are multiple ways of doing it. So I can add a patient from over here where it says add patient. Okay. But since Anita's a walk-in, I'll go to this section over here, click start test, select new patient, and I'll put Anita. Just Anita, I'm just going to make up your date of birth. Should we make you an early presbyope?
Yeah.
So let's say, um, 1980, and we'll make it up. Okay. So now your reason for visit. So let's assume she's here for a routine eye examination. Okay. We have multiple different types of examinations. So of course, all your patients, when they come for the first time, they will come for a routine eye examination. But then after that, you may call them for something else. You may call them for a contact lens fitting, an orthoptic evaluation, a cycloplegic, low vision, dry eye, myopia management, depending on what answers you find from your routine eye examination. So we're going to start here, and then what I will do, seeing as we're focusing on history taking, once we've done this role play, I'll show you one or two of the other templates where the history taking is a little different. For example, for dry eye or for pediatrics, where we have a couple of different things that we may have, or for binocular vision as well. Okay. Okay, so hi Anita, how are you today?
I'm good, but I have a couple of complaints, the reason for my visit.
Okay, so so you have some complaints with your eyes. So tell me, how can I help you today? What are you having trouble with?
So I'm very comfortable with my distance vision. So, but when I want to read something with finer print, I find it very difficult to work.
Okay,
But even when
okay. And is that with both eyes or just one eye? What have you noticed?
I haven't noticed.
You haven't noticed. Okay, no problem. And since when have you been facing this issue, Anita?
Maybe in the past 3, 4 months.
Okay, perfect. And is it all the time or just sometimes?
I think it's getting worse by the day.
Okay. And do you experience it? Are you able to carry out most of your daily routines, most of your near work, or is it affecting you very frequently?
It seems to be affecting very frequently.
Okay, fine. Perfect. And how much does it trouble you? Do you feel like you have to really focus and strain a lot to look at near things, or is it manageable?
For instance, if I want to read a paper or a book, I start and then I give halfway. I'm not able to complete the task because I feel sleepy, drowsy. I'm unable to concentrate. Even if I strain and read, it's giving me bad headaches. So I just give up.
Fair enough. So now, since you mentioned, so the next thing I wanted to ask you is this only for near work for reading, or does it also affect an intermediate distance, such as your computer or your laptop or anything like that, or is that not an issue?
Computer work, maybe I've increased the size of the font so
Okay.
I'm able to manage. I would prefer that it works for the computer usage as well.
Okay. And this was similar in the last 3 months as well, the issues with the computer? Okay. So in this case, she's managed to increase the font, so it's not as big of a problem. Okay, and just tell me a few other things. Do you have any other symptoms in addition to this? Like, are you getting regular headaches, any pain or redness in the eyes, anything like that?
Headaches, yes, whenever I'm trying to
Okay.
do anything. So if I have to concentrate for any near work, I do get headaches.
Do get headaches. And can you tell me if where can you point where your headaches are located most commonly?
So over my forehead.
Over your forehead, okay. And have the headaches also been in the last 3 months, or has that been longer or more recent, do you think?
In the recent past, I've been facing a lot of issues, maybe a month,
Since
the
a
headache.
month, okay. And how often do you get the headaches? Are they happening every day or maybe once or twice a week? What is the frequency of the headaches?
So every time I want to do something like reading or doing some near work, I mean, scrolling through my mobile, I am getting a headache.
Okay, fine. And the headache, is it so severe that you cannot function at all? Or is it sort of, okay, yeah, it's there, but I can get through my day?
So it starts with a dull ache, and the
Mm-hmm,
more I strain my eyes, the worse it gets.
mm-hmm.
So that's the problem.
And what do you have to do to make it go away?
I just close my near work and maybe I just want to rest. I don't
Fine.
want to read anymore.
Okay. So symptoms worsen with near work. Okay. Any other symptoms such as pain or redness in the eyes, or any specific, do you get eye fatigue and eye strain when you do near work as well? Yeah. Okay.
Eye fatigue, maybe pain around my eyes too. Is it the headache or the eye pain? I really can't figure out, but I
Okay.
think my eyes ache, my head aches.
Okay. Fine. And that's also both eyes, correct? Okay, perfect. Any pain inside your eye or any redness in the eye? No.
I
Do
haven't.
you ever, fine. Do you get double vision where you see two things instead of one ever?
No, I haven't
No.
noticed that.
Okay. Any sensitivity to light?
Not really.
No. And do you ever see flashes of light in front of your eyes? Any black spots floating across your vision?
No,
No. And do you ever get any kind of watering or sticky discharge coming from your eyes?
maybe at times.
Okay,
I
how
itchiness. I have itchiness
you
at,
do have some itching. Okay, is that in both eyes as well?
yeah, it keeps alternating between eyes. I'm not,
Between. And since when has that been going on?
maybe 15 days.
Okay. And and how often does that happen?
I would say it's not pretty often, it's not constant. Once in a while, my eyes do itch.
They do itch. And is it really, really bad? Do they get puffy and swollen, or is it sort of quite mild?
I haven't noticed that. Maybe it's too mild.
Okay, fine. All right, perfect. All right, great. Is there any other issues with your eyes at the moment? Your main issue is the trouble with looking at close work and the associated headaches and eye strain, which are all
Yes.
associated with specifically with reading and looking at the phone.
Yeah.
And what is your reading material, books and newspapers typically?
Typically, I read a lot of fiction and non-fiction books, which has real fine print, newspaper.
Fine.
So that causes a lot of strain. Mobile, again, I at times if I really have to work on the mobile, then I increase the font size and I'm managing with it. But I know it's not going to help me in the long run. But I'm very fond of reading books, so that's a big issue now.
Okay, perfect. So you read. Okay. And what is your occupation, Anitha?
So I'm a teacher.
And how many hours a day do you say you spend on a screen on
So
average?
we do use digital screens a lot in the school. So
Mm-hmm.
maybe 6 to 7 during the
Okay.
day.
And is that 5 days a week, 6 days a week?
5 days.
5 days. And do you smoke?
No.
And do you drive?
Yes.
Okay, perfect. Right. I just want to know a little bit about your history in terms of in terms of your eyes. Have you ever had any surgery in your eyes ever in your life? No. Have you
No.
ever had any serious injuries to your eyes? No. Any serious infections in your eyes?
Yeah, I think I've had conjunctivitis a couple of years ago.
Okay. Do you remember which eye?
I don't remember.
And what happened? Was that all sorted out with drops?
Yeah, the doctor gave me antibiotics for a week and it got better.
And you haven't had a recurrence since then?
No, no.
Okay, perfect. And have you ever been told that you have any kind of eye disease, such as glaucoma or any kind of disease at all?
I haven't had a chance to get that.
Okay, no worries. We'll have a look today. And how is your general health?
I do have thyroid problem.
Okay, and you're on medication. And since when did you have you been diagnosed?
Past 4 years.
And it's an underactive or overactive thyroid?
It's a underactive.
Under hypo. Okay. So 4 years ago. Okay, perfect. And you're on some medication for that? You're not, there's no diabetes or blood pressure, any allergies or asthma?
Mm, Not that I know of.
Not that you're aware of. Okay. And so you're on medication, tablets, I'm presuming. Do you know what medication you're on?
No.
But you're on tablets for the thyroid. Okay, perfect. And are you using any eye drops or anything like that at the moment? No.
No. I think I'm using something which is a green colored bottle. I don't know the name. I use them
What?
occasionally.
Okay, and what is that for?
I mean, for tired eyes, my friend recommended a green bottle, so I don't know the name of the eye drop.
Okay, no problem. Okay, we'll see. We'll have a look at your eyes and then decide whether or not you should continue to use those drops. Okay, perfect. Do you know if there's any family history of any eye disease? So when I'm talking about family, I mean your parents, grandparents, or siblings. That's it.
Grandparent had a glaucoma.
Okay, perfect. Okay, and any family history of diabetes or cardiac issues?
No.
Perfect. And do you currently wear spectacles? Okay. And when was your last eye examination?
Maybe a year and a half ago.
Okay, so about 18 months ago. So let's just say. Uh, perfect. Okay, I'll just check your glasses and make note of the previous prescription. Do you wear any contact lenses at all? No.
No,
Okay, perfect. All right, is there anything else you want to tell me that we haven't already covered?
I don't remember anything else.
Okay, wonderful. Thank you very much, Anita. Now we'll move on with your eye examination. Okay, so as you guys can see, it is a very systematic way of documenting the history, and you can customize it as per your requirements. So if you noticed earlier, when we were talking about her symptomatic history, she started mentioning that she likes to read. So I immediately skipped ahead into the lifestyle section and mentioned in the hobbies that she likes to read. So when the patient comes back, when she comes back in the future, she will be able to, I'll look at this and I'll say, how is the reading going now? Are you still having difficulty? Or are you able to manage? Also, this has given me a lot of information just from her symptomatic history. I can clearly see from her age, she's probably a first-time presbyope. She's having headaches, all those regular symptoms that we see. But had I not documented such a detailed history, I may not have been able to ascertain that. Now she is having a couple of issues which may be unrelated, like the itching, which may be unrelated to the reading, but we can see that most of the symptoms, as she described, were all to do with reading books and mobile phones. So at this stage, as a practitioner, I can quite confidently say that, even obviously I'm not going to say anything to the patient at this stage until I've conducted the full eye examination, but we can quite confidently say that this patient is probably a first-time presbyope and she needs some reading addition to help her with her near work and her computer to make her, life a little bit easier. Okay, so now let's assume we've done all of this, or we're going to do all of this. So we're going to skip ahead to the action and advice. And one thing that I wanted to experiment with is just based on this, something that will really help first-time users, is we have an AI which will help you a little bit with the sort of management of the patient. So something that people really struggle with is the management of the patient. Now, to be honest, I've never really experimented with it just by putting in the history. So what we can do is we can see what it tells us when it comes to just putting in the history. So I'm just going to click on Ask ASIRA AI and let's see what management it gives us, what answer it gives us, just based on the history that we have entered. So it just takes a couple of minutes to process, so we can sort of see. It's reading the history taken. Obviously, as you can see, all the rest of the sections for the eye examination are blank. We've not filled in anything. So because we've not done a lot of the examination here, in the confidence, it's only given us a 70% confidence because we've not done a full examination. So, but having said that, referral to dry eye clinic, I guess because of the itching, it's mentioned that, but of course it cannot make that decision, sort of inferring that maybe because of we had mentioned, if we just go back to the history and symptoms, we had mentioned that she is having itching, eye strain, fatigue, which are also symptoms that can be associated with dry eye. So we haven't done the examination. So based just on the history, it's made some inferences. And I will, and you can see it's given you proper near work ergonomics, adequate lighting, regular breaks, adaptation to new lenses, and symptom improvement. Okay, so it's given you a very clear plan, and it's also prescribed progressive addition lenses. So I'm just going to do this again one more time and show you how it has come up with these conclusions. So if you have a look over here, it'll ask us to show reasoning. Okay, so I am going to click on this. Now, let's just go through what reasoning it has given. So number one, patient reports constant reduced near and intermediate vision, headaches, eye strain, and fatigue, all worsening with prolonged near work and screen time, indicating uncorrected presbyopic or accommodative stress. Okay, so already, and this is all the information now this AI has done for us, but as practitioners, these are also inferences that we can make from taking a good history. I mean, AI's only been around for the last year or two, and we were doing all of this exactly like this way before, okay? But this will help you as a guideline. So look, very clear, no current refractive correction, documenting, and so obviously we will need to do a refraction. We've not done it. Symptoms of itching and asthenopia alongside heavy screen use suggest evaporative dry eye. Okay, again, this is just an inference that's made only from the history which we would make. So then it indicates that, okay, we should also check for dry eye in addition to the obvious presbyopia. She's a 45-year-old female, so indicates that at her age, she can be a candidate for early signs of dry eye as well. Okay, referral to a dry eye clinic, or you guys can, obviously, we have our own dry eye clinics as well. So we would probably call her back to do a more thorough dry eye assessment if we were to find something on the initial examination. And advise ergonomic modifications, so proper lighting, posture, 20-20-20 to reduce digital eye strain, because we have mentioned that she spends 6 to 7 hours on a screen. And follow up in 2 weeks allows assessment of symptomatic relief. So when you have documented all of this very, very clearly, these are inferences that you can make from just taking and documenting a really good history. Now, the way that, as you can see, the way that ASIRA will help. So what we're going to do is we are actually going to put all of this into, we're going to, normally we may not, but we're going to put all of this in the report, which we share with the patient, so that you can see how systematically and how neatly it is documented. So you are able to share that with the patient. You are also able to manage it yourself. So I'll just add all of this. Give me a moment. We'll skip this because there's no family history, and we'll add the lifestyle section. Okay. And we will add the action and advice and finish the examination. Okay, so we've not refracted, so there's no spectacle prescription. But if we have a look at this, now you can see how easy and systematic it is for somebody else to see this, okay? So somebody else, an ophthalmologist, or any of you guys can have a look at this report and just see very clearly, this is what the complaints are. This is, and we've made a little remark that it's worse with reading, and then it goes systematically to the ocular history. She has had an ocular history before. Then she has a systemic history of thyroid, and she takes eye drops. She takes eye drops and tablets, and eye drops for tired eyes, unsure what it is. She has a grandparent with glaucoma, and she has some lifestyle changes, and this is the management. So it's a very, very systematic way of being able to look at things and how you will look at your previous history again. So it's just a very, very good example. Now, I know all of you guys are really itching to see the rest of the software, but we are not going to do that today because we're going to do it alongside Learn Beyond Vision. And as and when we do more and more, we can discuss that.
Any one of you as LBV members is interested in ASIRA, please message us and write to us. We'll connect you with Isha, and she can personally have all these links shared and detailed. It's a lovely thing for those of you who practice. My personal experience is there. I'm in the 3rd year on ASIRA, and documentation is as important now for us with the coming of the bill. You have the scan here, you can discuss this, and there are beautiful modules which I would leave it as a suspense and didn't take it further, because we want you, if it's a contact lens specialty patient, if it's a low vision patient, if it's a myopia control, dry eye, anterior segment, or you name it, you have those modules which will give you the thought process to go ahead. So thank you, Isha, wonderfully conducted. Thank you, Anitha, for being an excellent patient to give that history.
So for all those who have joined us today, I just want to tell you guys that Isha will be joining us for the future sessions as well once we complete each of the modules. So we're going module wise. So we're done with the history part of it. In the coming weeks, we're going to be covering different aspects of objective refraction and subjective refraction. Maybe by the end of these two modules, we will be inviting you again to show us how to document these on ASIRA. And believe me, ASIRA is a real boon to all of us. There's a lot of hard work that has gone behind the making of ASIRA. The best part being ASIRA is made by the optometrist for the optometrist. So it's a great tool. I mean, for all those who are interested, I suggest that you take up the 30-day trial. And, you can connect with Isha or one of us. We will connect you to her. And you should be trialing this software for sure.
The first step towards achieving your dreams is having the right coach. Get the best education with Learn Beyond Vision and make your optometry dreams come true. Download the app now.